Hey everybody, this is Kevin Bass from thedietwars.com, and in this video I'm going to be taking apart a very prominent myth, a very widespread myth, perhaps even the mainstream view about what causes diabetes. Now, this is not the mainstream view within science and among scientists. Among scientists, there's a completely different view, which is the view I'm going to be presenting instead and explaining that view in order to help people understand what the science actually says about what causes diabetes. Now, the way that I'm going to do this is by analyzing a paper by a physician and clinician who's somewhat prominent on social media, and particularly Twitter, by the name of Dr. Tro Kalayjian. So Dr. Tro Kalayjian presents 3 case studies in this paper where he claims that these 3 case studies support the currently commonly conceived widespread myth about diabetes, and he's trying to show that this myth is actually true and that scientists are wrong. So scientists have it all wrong, and through these 3 patients that he saw in his office, he's going to demonstrate that actually this weird set of ideas that scientists have is incorrect. And in fact, the lay or common or widespread current view among people who are not medically and scientifically trained is actually the correct view. Now, by taking this paper apart and then showing how it's wrong, I can then explain both how the myth, as I pointed out, is wrong, as well as showing, again, what the current science says. Now, a little bit more context, even broader than that, is also really important. So, diabetes, as everybody knows, is diagnosed by a blood test. One can look at the fasting blood glucose. I believe you need 2 fasting blood glucoses at different times in order to confirm. I think it's above 125 milligrams per deciliter. Somebody who's more up to date on their diabetology, especially within the context of clinical practice, can let me know if I'm wrong about that. But I believe it's 125 milligrams per deciliter fasting blood glucose, or fasting blood glucose. Likewise, you can also diagnose it through a blood test after a glucose bolus. You give somebody 100 grams of glucose. I think you wait an hour, and then you check the blood glucose levels. If they're above a certain amount, then that person has a diagnosis of diabetes. Likewise, you can check it with a HbA1c, which just checks the amounts of sugar that are essentially bound to red blood cells. And if it's a high amount of sugar bound to these red blood cells, it's bad. And that's also a way to diagnose diabetes. Now, these ways of diagnosing diabetes aren't necessarily the best ways. It's arguable, and I think it's probably correct, that continuous glucose monitoring probably provides a better lens and a better understanding of glucose metabolism in a way that could be algorithmically determined through some sort of computer program, not through the user just looking at their graph, but through a computer program that algorithmically looks at certain pieces of data to then determine whether or not somebody has metabolic dysfunction or diabetes. Now, that said, we don't have that yet for everybody. And so we have these 3 main tests for determining whether somebody has diabetes or not. Now, the interesting thing is this focuses on blood glucose. But as scientists have pointed out throughout the past 100 years, this focus on blood glucose is a historical accident. So the reason blood glucose was focused on was, I believe, diabetes patients had urinated, the sample was collected, and a clinician saw flies attracted to it. And so the clinician would taste it. In fact, this was the old way that diabetes was diagnosed. It's a sweetness in the urine. That was a traditional method of diagnosing diabetes. But here's the kicker. That's only one biomarker. That's only one thing, only one aspect of metabolism that is disturbed, glucose metabolism. But in fact, everything is disturbed in diabetes, not just blood glucose. But unfortunately, because diabetes became so tightly associated with this idea of blood glucose dysregulation, and because blood glucose became the main mechanism through which we tried to diagnose it, and also to gauge how well it's under control. Unfortunately, what happened as a result is that we came to associate diabetes with aberrant blood glucose. And then we came to believe, or many people have come to believe, that diabetes is caused by excess glucose intake, or excess carbohydrate intake, or excess sugar intake, such that this is the direct cause of the rise in blood glucose. The body can't manage that excess rise in blood glucose, that excess of glucose that one is eating, and as a result, one gets diabetes. This is not correct, and it's an historical accident, because if you would look very closely at the metabolism of somebody with diabetes, you would see not just blood glucose that is deranged, but also a derangement in fatty acid metabolism, in protein metabolism, in every single aspect of energy and of anabolic and catabolic processes. Everything has been undermined and changed and deranged. And if we had the tools originally to look at that, for example, tasting it, if we had the tools to look at that differently in the past, then perhaps we would see diabetes through a totally different lens rather than a blood glucose. But because we have the blood glucose lens, it has given rise to this misconception that diabetes is caused by carbohydrates, and it's not at all. Now, based on that misconception, a group of entrepreneurs online and also through popular books have presented this idea that diabetes is caused by carbohydrates, and so therefore the best treatment for diabetes is a carbohydrate restricted diet. Because if the carbohydrates are causing the diabetes, then take out the cause of the diabetes by taking out the carbohydrate. Makes sense according to the traditional flawed view, but this view, as I've pointed out, it's incorrect. Nonetheless, these entrepreneurs have, because it's so commonsensical, because it makes sense to lay people who don't study diabetes, they've created an industry out of this. And in fact, they've created an industry that blames doctors for not seeing the easily observable truth and uses this idea of victimization of, I got diabetes and I couldn't treat it because doctors didn't tell me the basic simple truth that all I needed to do was restrict carbohydrate, and therefore my diabetes would be gone. And so the doctors betrayed everybody, essentially. That is the idea. The doctors betrayed everybody, and as a result of this betrayal, many people aren't getting the proper treatment and prevention that they need to treat their disease. Okay, so this clinician physician who wrote this paper that I'm going to be taking apart, this guy, he runs a clinic based on this idea of restricting carbohydrate, and that is the treatment of diabetes. And he believes that restriction of carbohydrate alone causes dramatic improvements in diabetes according to this model, this lay model, the mainstream popular model of diabetes. He believes that all you have to do is restrict carbohydrates. You don't need weight loss. You don't need anything else. And then you can achieve remission of diabetes. The problem with that is that a scientist by the name of Nicola Guess published a preprint. It's still not published in peer-reviewed journal yet, which is interesting. She needs to publish it in the journal, but she published a preprint that got a lot of traction online. showing that at different levels of carbohydrate intake, keeping weight the same in diabetics, I believe she looked at 15, 30, and 45% carbohydrate diet, or maybe in 10, 20, and 30%. In either case, she looked at a range of carbohydrate intakes and she didn't see any change in the blood glucose of people who had these different levels of carbohydrate intake. Her conclusion, therefore, was that, in fact, carbohydrate intake doesn't alter diabetes. The only thing that alters diabetes is reduction in body weight. And in response to this, oh, by the way, one more thing that's important to note is that Nicola Guess was a big fan of low carbohydrate diets for the treatment of diabetes. Before she started the study, she wanted to prove that low carbohydrate diets could reverse or improve diabetes without anything else. No weight change, nothing. You could just remove the carbohydrate and get improvements in diabetes. She wanted to show this, and so she was surprised by her results because it didn't show what she thought it would show. Okay. Now, in response to this, because this paper got so much traction, this preprint got so much traction, Tro Kalayjian, he didn't want to believe this. He didn't want to think that, this paper was correct. He thought there were many flaws with it. He actually posted vociferously online about the many flaws. And if this paper was seen to be correct, then what is he doing? Why does he run a clinic that restricts carbohydrates? Why would his patients want to listen to his advice if his advice is not based on something that's scientific? So what he said is, okay, fine. You guys think you've shown this, but actually I have patients. That have barely lost any weight at all, just restricted carbohydrates, and seeing their blood glucose almost normalized, not be diabetic anymore. And so therefore, you guys who say this are wrong. These scientists are wrong. Just look with your own eyes at actual patients, and I'm showing you some case studies of these patients. Look with your own eyes and you'll see that you're wrong. It's obvious how you're wrong. Why are you so wrong? Why are you essentially getting in the way of patients getting good treatment and prevention for their disease when you could just restrict carbohydrates? Why are you trying to stop that from happening? And so he's vociferously accused scientists of all sorts of bad things, and of being incompetent, not intelligent, just lost, because they can't see this simple fact. And so his paper that I'm going to be discussing in a moment is fleshing out this idea that only carbohydrate restriction alone can reverse diabetes. His paper doesn't show what he thinks it does. And by analyzing this paper, as I've mentioned, and tearing it down to its component parts, I'm then going to show what the actual real cause of diabetes is, and it's not what he says. Without further ado, let us begin taking apart this paper and setting some of the context for the taking apart. So as he tweeted last year, around the same time, he said, diabetes is improved only with weight loss. And then he tags many people. He tags Stefan Guyenet, he tags Nicola, he tags Elaine Norton, and he tags myself. He says, me, you are wrong. Carbohydrate restriction accounts for 80% of excess glycemia, that is to say 80% of the excessive blood glucose in the blood. And he saw an A1C, which is, again, the glycated hemoglobin, the red blood cells. They have glucose molecules that bind to them. And the degree to which the blood glucose binds to these red blood cells is an indication of how bad your average blood sugar is over the course of the last 90 to 120 days, depending upon the individual. So a high A1C, so high glycated hemoglobin is bad, and then a low one is good, and you want below 5.7, if I'm not mistaken. And I think 6.5 is the diabetes cutoff and 5.7 is pre-diabetes. It's been a while since I was in medical school. As I said, as you guys know, I'm finishing my PhD, so it's been years. But I believe it's a 6.5 A1C that's a diabetes diagnosis and a 5.7 that's pre-diabetes. So he got him all the way down to 6.7 from 12, which is nearly double what you need to get a diabetes diagnosis. It's a dramatic and astronomical high number, and he got him, and he halved it all the way almost to the cutoff, which is great. And he says there's no weight loss, there's minimal weight loss in our patients. So therefore, most of this stuff, most of the glycemia is due to, the blood glucose is due to carbohydrates. Just restrict the carbohydrates, restrict the sugar, then you're going to restrict the blood glucose too. The blood glucose is going to go down. It's obvious, is it not? And I'm going to indeed show this in my case study. This is the idea. Okay, let's talk about this. This case study is called Treating Diabetes Utilizing a Low Carbohydrate Ketogenic Diet and Intermittent Fasting Without Significant Weight Loss, a Case Report. The first author is Kristen Gavidia, and perhaps it's a medical student or maybe it's a professor at Tro. And then there's Tro Kalayjian. He's the corresponding author and the lead author, of course. Now, in this paper, he reports that there's 3 patients, as I said, and one patient loses from 262 pounds to 254 pounds. Okay, so loses a modest amount of weight, 7 pounds, 6, 7 pounds. Another patient loses about 10 pounds from 205 to 195. Another patient loses about 8 pounds from 157 to 150, so it's 7 pounds. But despite this modest weight loss, it's just a tiny amount of weight. It's like less than 10 pounds in all cases, except for one case is only 10 pounds. 10 pounds or less, not much. They nearly normalize their blood glucose, so they're not necessarily getting down to diabetic or pre-diabetic or normal blood glucose, but it's a dramatic improvement, which is 10 pounds of weight loss. So he's saying, look, it's not the weight loss that's causing the remission, it's the reduction of carbohydrate. You shouldn't get, if it's weight loss that's causing it, why are they just losing barely any weight, but then having near remission of their diabetes, dramatic improvements? It's not caused by the weight loss because it's not enough to get them down to a normal weight. So it can't be the weight loss. It's got to be the carbohydrate restriction. Minimal weight loss, massive carbohydrate restriction. It's the carbohydrate restriction that's causing it. It's not the weight loss, obviously, as he would like to believe. And yet, there is quite a problem with this view, and that is just one moment, please. My computer is being a jerk. And that is this study, and in fact, a series of studies. So, there was a study that took 11 men and women with diabetes and tracked the metabolic changes during weight loss. And it was conducted by this researcher in the UK named Roy Taylor. And what he found is that in just 7 days after starting people on a severe calorie restricted diet, in just 7 days, they saw near normalization of blood glucose and near a 36% drop in blood glucose in just 7 days. Okay? As you can see in this graph, the x-axis is weeks. So 1 week, 7 days, you see a near normalization of blood glucose. In fact, you're already at the pre-diabetes range. And the open circle, as you can tell, is actually normal. It's normal people without diabetes. So you're almost at normal. You're definitely not diabetic anymore. And that's just 7 days. Wow. Here's the thing. Weight loss, well, the average weight was 103 kilograms. The weight at week one is 99 kilograms. So this is 4 kilograms weight loss, or 8.8 pounds. normalization of weight at just 8.8 pounds weight loss. Well, how much weight did Tro's patients lose? How much weight did Tro's patients lose? His patients lost 8.7 pounds on average. That's interesting. So the average weight loss that causes near remission of diabetes in this trial, just within just 1 week, caused a similar result in Tro's patients. That's interesting. So maybe, in fact, it could be the weight loss after all. How did this happen? Well, a rapid reduction in liver fat. So as you can see here, if you look at figure C, you look at the hepatic triglyceride content, its percentage, how much content of the liver is triglycerides. You can see a reduction in content of, within the first week, I don't know, 30%. It's nearly 30% in just 7 days. And if you look at the liver output of glucose, you see an even more dramatic reduction. Again, in just 7 days. And you see a tripling in liver insulin sensitivity. Again, in just 7 days. Okay? In other words, extremely modest weight loss massively improves liver glucose metabolism. This isn't on a low carbohydrate diet. This is just on a calorie restricted diet. This is because liver fat is burned preferentially to other sources of fat. The body taps into it first, which is very good because liver fat is a major contributor to diabetes. Thus, large improvements in glycemia can be seen with very small amounts of weight loss. As counterpoint, this study showed, and Tro found in his patients as well. Now, let's take a brief intermission to point something out. What seemed so obvious and clear at the beginning to Tro when he was thinking about why his patients would have seen these results, it seemed so obvious and clear. Once you learn a little bit more about the physiology, suddenly the interpretation reverses. Okay? Now, this isn't the only kind of situation where this kind of thing happens. If you think about, for example, what people during the Middle Ages thought about the sun and the moon and the earth. What's the relationship? They thought the sun went around the earth, right? And it's clear why they did, right? It's obvious. It's not weird if you think about it. Look, if you're just standing here, you don't have a telescope, you're watching the sun moves across the sky, right? It clearly moves across the sky. It's clearly the sun that's moving. Why would you think that the earth is moving around the sun? That doesn't make any sense. Like imagine how fast the earth would have to move around the sun. If it's like that big, geez, it would have to be like, why doesn't everything blow off the earth? Like, you know how it is if you're in a car and like the window's open, like all the air gets sucked out. If you're in an airplane and like there's a hole, you guys have seen the movies, that actually happens. Like everything gets sucked out of that hole, right? Why doesn't like everything get sucked off the earth immediately because it's moving so fast around the sun? There are all sorts of arguments like this. Like this doesn't make any sense. And yet, once you learn a little bit more about how the physics works, you can answer all of these questions. And then it becomes obvious that, of course, the earth goes around the sun. But you have to have the knowledge first. So it's a similar sort of situation here. It's like, look, it seems to be the case that blood glucose and just restricting carbohydrate, the blood glucose goes down. So it's got to be the carbohydrate is causing the blood glucose to go down. They're not losing much weight. So come on, Come on, Kevin, like, let's be real. Like, obvious. It's like the blood glucose is going down because the carbohydrate is going down. Okay? Like, it's obvious until you learn a little bit more. You're like, oh crap. These data are actually, in many ways, more consistent with a weight loss model, even though the weight isn't changing so much. But that's because most people don't understand, justifiably. You're not going to understand this in a high school biology class. Most people don't know that fat gets stripped out of the liver first, and your blood glucose and your insulin sensitivity is going to be dramatically altered as a result of just small amounts of weight loss in a brief period of time. But most people don't know that. So they assume that this idea of minimal weight loss is true, and it's the carbohydrate restriction. But once you get a little bit more knowledge, you understand that that's not the case. It's the same thing as the Earth going around the sun. That's how science works. It's like some things that make sense intuitively aren't actually the case once you actually learn a little bit more about how the science works. So, but let's ask another question. Why, therefore, is more than very modest weight loss recommended for diabetes? Why don't they just like have very modest weight loss? Cure your diabetes. Because if you want to get remission, full remission, that means total reversal of diabetes, and these patients didn't get it quite yet, the ones in Counterpoint. And not just a decrease in HbA1c, you need more than just an initial modest weight loss. You need more than that. You need a lot of weight loss. We know this from a trial called DIRECT. Here's DIRECT. They gave people a shake, essentially. It's a weight loss shake, hypocaloric. I believe it's 800 calories they gave. I think there was a starting period of 1,200 calories, and after that starting period of adjusting, then they started going down to 800 when people really started to lose weight. And the people who adhered to it a lot, they lost a lot of weight. Now, the people who lost 15 kilograms or more, which is more than 30 pounds, maybe it's like 35 pounds, it may be, I don't know, like 33 pounds, maybe. I want to say 33 pounds. The people who lost 33 pounds or more, 86.1% of them reversed their diabetes. They no longer have diabetes anymore. And there's a dose-response relationship. So the more weight loss, down to none, of course, and none gets 0% remission. The more weight loss, the greater the remission. You need more weight loss than this just an initial weight loss. So Tro and his patients, Dr. Tro, saw a tremendous amount of weight loss in his, a small amount of weight loss in his patients and didn't go further. So they saw a dramatic reduction in glycemia, but they didn't get reversal of their diabetes. They didn't get remission because he didn't go far enough. That explains his results perfectly. So, it's interesting. So he presumably modestly reduced his patient's liver fat. This is why he only decreased the HbA1c. Remember that percentage that he got? It went from 12 to 6.7%. But he didn't normalize it. He didn't cause remission. And you can see here that the average level of A1C dropped 5.2 points from 11.9 to 6.7, and the average weight loss was 8.7 in all three patients. Right? He didn't get diabetes remission because remission is 6.5. You want to get diabetes remission, you got to get below 6.5. And then if you want to get below pre-diabetes, and you get below 5.7. Didn't get that. But he saw a modest weight loss, and that's good enough, as we've seen in this trial. And it's very similar to what they saw in this trial. So in this trial, where they saw a much larger weight loss over the course of an 8-week trial in a Counterpoint, right? In Counterpoint, they saw, let's see if we got the weight loss. Counterpoint. I didn't put it here. But in Counterpoint, they saw a much greater, I think I put it, yes, let's go up. Is it? Here. In Counterpoint, they went all the way from 103 kilograms all the way down to 88 kilograms. So they saw 15 kilogram weight loss, very similar to what we saw in direct for the cutoff of the remission of diabetes, complete reversal in the patients 15 kilograms or more. In this case, we saw an average of 15 kilogram reduction. Cool. Average BMI went from 33 to 28. That's amazing, 5-point reduction from obese to just simply overweight. Now, 103 to 88, 15 kilogram, what happens? What happens to the plasma glucose over time? It continues to go down. It continues to go down as you lose that weight. And the HbA1c, which he's looking at as a marker of diabetes reversal, the HbA1c crosses the diabetic threshold by week 4, where they've already lost almost 10 kilograms or 22 pounds, okay? Just much more than, 3 times more than Tro's patients lost. So of course Tro's patients didn't get reversal of diabetes. They only lost a modest amount of weight, whereas these patients in Counterpoint lost enough to get reversal of diabetes by week 4, okay? Okay, you can see that here. And it's probably the case that as you lose some of that weight, the slower you do it, the less you're going to lose it from the liver. This is my belief, my personal belief. There's reasons to believe this indirectly from multiple different studies. People who lose weight over longer periods of time, they don't have as much of a benefit. It's really got to be quick. And then if you maintain that weight loss and keep losing weight, you're going to prevent the blood glucose from coming back up again, I believe, because you're going to prevent fatty acids from getting redeposited in the liver. But that's just an aside. And if you're a diabetologist, let me know if you think that's plausible or if that's wrong. That's the one thing I'm going to introduce here that is sort of proprietary. I believe that's the case. That's explained so many different of the clinical trials, but we don't have hard evidence for that yet. And there is one trial that suggests that's not the case, but I believe that if these patients had only maintained a blood glucose, the weight loss of like 8 pounds, their fasting blood glucose would have gone up a little bit by week 4 and week 8. And it's maintained at such a low level because they continue to lose weight. Okay, but in any case, you get progressive reductions in HbA1c over the course of that study, 8 weeks, until you get a remission of diabetes after like 30, 35 pounds, whereas Tro's patients only lost 8 pounds. Okay, so it's very important, that difference. 4-fold more decrease in body weight. As a result, they get remission of diabetes. Tro's patients didn't see that. Okay, all right. Now, you also see, in addition, a loss of fat in the pancreas. And why? This is because the liver fat feeds the pancreas. So you want to get more loss of liver fat. The more loss of liver fat that you can get, the less the liver feeds the pancreas and makes the pancreas fat. Okay? And if the pancreas gets fat, it can't secrete insulin, can't bring down blood glucose. So you want to get more weight loss in order to fully strip as much liver fat as possible, as much pancreatic fat as possible, to fully restore full insulin sensitivity and insulin secretion, which you don't get if you only lose 8 pounds, which is why Tro's patients didn't get reversed their diabetes. They just got a dramatic reduction in blood glucose, but not a reversal. Okay? In bariatric surgery, and I think this figure is in bariatric surgery, where people with diabetes have fatter pancreases at baseline, the surgery causes the pancreas fat to normalize and restores normal insulin secreting function. Same thing happened in Counterpoint. As weight loss progressed, the pancreas fat, one moment please. As weight loss progressed, the pancreas fat was progressively reduced, and insulin secreting capacity of the pancreas increased. Okay? This is probably because as the liver itself becomes less fatty, it secretes fewer triglycerides, as I mentioned, and which are then no longer available to make the pancreas fatty. And as in the less fatty the liver, the fewer the triglycerides, and therefore the less fatty pancreas. And we can see this over the course of the 8-week trial. They went from 12.2%, 12.5% hepatic pancreatic content, all the way down to 2.5%, like a 5-fold reduction in pancreatic triglyceride content. Okay? And this is known as the twin cycles model. According to it, reversal diabetes, you see an initial immediate drop in fasting glucose, but then over time, as you continue to lose more weight, more fat, more liver fat in particular, you get prolonged restoration of pancreatic function, commensurate with the degree of weight loss and therefore liver fat loss. So Dr. Tro, in his paper, he nabbed the first part. He got it. He got that initial drop in blood glucose, but he missed the second part because he didn't get enough weight loss. Hence, the big reductions in blood glucose with very modest weight loss, but on average, no remission. This is because Tro is not getting that pancreatic fat cleared. Okay? In fact, Tro seems to have intentionally tried to keep his patients from concerning themselves with weight. This probably was to their detriment. So he says, we counseled them on literally not tracking calories, not controlling portions, and we just lowered their carbs. So they're going to get some initial weight loss from the carbohydrate restriction, but it's not going to be enough, right? Because carbohydrate restriction by itself, if you're not mindful of other things, some people do get a dramatic amount of weight loss, but most people who are getting a dramatic amount of weight loss are changing a lot of things at once and not just their carbohydrate intake. They're having like this global health revolution in their lives. They're totally turning everything over. And it's not just about carbohydrate intake for most people who have these miracle stories. But you can reduce carbohydrate and get a substantial and modest amount of weight loss in most cases. And it's been shown many times. Okay? On average. Now again, there's outliers, but on average it's going to be about a modest amount of weight loss. Consistent with about 10 pounds, which Tro saw. Okay? But it's a real shame, because if he had, told people to actually change more things, hold on a moment, I'm trying to get the slides. Can't figure out why I can't. Oh, that's the last slide. Okay, cool. So, as I mentioned, it's a shame because if he had followed the science, he might have helped his patients achieve actual diabetes remission. So overall, it's an interesting paper, and it's only to give a deep dive on the twin cycles model. And the twin cycles model is the reigning model among diabetologists and among scientists about how diabetes is caused. It's through pancreatic and liver fat. And weight loss causes the reduction in this, which then reverses diabetes if you have a pancreas that's still functional, sort of beneath that layer of fat if it's still kicking. In some cases, if you had diabetes for long enough, your pancreas isn't going to come back. But for a substantial amount of people who haven't had it for too long, you can get reversal, you can get pancreatic function restored. Cool. So that's the video. That's the explanation. That is the word on diabetes, what causes it, debunking the myth, tearing that apart, and explaining to you why the biology works as it does. If you liked it, check me out on Twitter, Instagram, TikTok at Kevin Nbass, KVINNBASS. Also check me out on Patreon. You can support me on Patreon. That'd be much appreciated. You can also support me on through a direct donation at thatwars.com/support-me. That would be super appreciated as well. In addition, check me out on my podcast, The Kevin Bass Show. It's going to be available both on YouTube and on your favorite podcast directory. You can see me, my beautiful face on YouTube if that is your inclination. Or just listen to me on Spotify or on Apple Podcasts or your favorite such channel. Please leave a review. If you're one of my long-time listeners, leave a review on Apple Podcasts. I'd be super appreciative. I would love it. Please leave a review on Apple Podcasts. Leave a rating on Spotify. Leave a rating on Apple Podcasts as well. We want to get me above 3.8. I want to get me above into the 4 range, so 4 point something. When I first launched podcasts, I made a lot of people mad because maybe I was a little harsh about things that they were saying that were wrong, and so a lot of people review bombed me and tried to get me down as much as they could. So if you guys could help to restore that and get me above 4, that would be cool. I would like that. I would like to have it above 4. On Spotify, it's 4.0. We can get it above 4.0. We can get it to 4.5 eventually. That would be great. So please review it and give me above 4.5. Awesome. If you liked the video, only if you liked it, and under no other circumstance should you ever do so, but if you liked it, press the like button. It's on the bottom right side, and press the subscribe button. That'd be cool. Then you can check out here and see all the videos that I'm going to be releasing. And you can also turn on the notifications. So if you turn on the notifications, you get every single video. It pops up in your notifications on YouTube and lets you know that I've released something new. And if you can turn on notifications and you are a subscriber, go ahead and turn on notifications. That would be great. Turn on those notifications. Turn them on. Cool. I think I've covered everything. Oh, leave feedback. Positive feedback is preferred, honestly, especially if you see haters. There's always going to be some haters. I usually just delete them and ban them from the comments. If they're just you're ugly, or do you have a speech impediment, or do you have autism, or do you have dyslexia? People will say stuff like this all the time. Just or they'll say, are you manic? Are you on coke? They'll say this kind of stuff. And I delete the comments and just hide the view. They can't comment anymore. But if you see those and you're hey man, I want to give Kevin a break and tell him he's improving, he's doing a good job, that'd be great. If you can, let me know some very specific things they can do to improve. That'd also be awesome, because I would love to continue improving, which is what I'm doing. I'm doing that all the time. So I appreciate that, and appreciate all you guys, your help, everything. Leave comments if you have any questions about anything I've talked about here as well. That would be super cool. Or just leave comments for the algorithm, or for the algorithm, or just leave comments. Share it with your friends and family. Let them know how diabetes actually works and how it doesn't work. Because I've just torn apart the traditional way, according to the foolproof paper that was supposed to be published that would show the traditional way. And therefore, if you guys could share this around, let people know, spread the word, that would be awesome. Appreciate it. Hope you guys are enjoying your day, and have a nice day if this is the morning for you, and sleep tight if this is the night, and see you guys in the next video. Peace.